Pregnancy brings many changes, and some believe they hint at a baby's sex, though this is not scientifically proven. Here are some symptoms that are often believed to indicate a girl. Morning sickness is often stronger in the first trimester when carrying a girl, possibly due to higher estrogen and HCG levels, though studies show the difference is not always reliable. When carrying a girl, it's often said that girls steal your beauty. You may notice more pimples, duller or oilier skin, and hair that looks thinner or less shiny. When carrying a girl, many women experience stronger cravings for sweets such as chocolates, cakes, and fruits. Some also report a greater desire for dairy products like milk, yogurt, and ice cream. When carrying a girl, the belly is often said to sit higher and appear wider. In addition, weight gain may be more noticeable around the hips, thighs, and buttocks. When carrying a girl, it is often believed that the fetal heart rate tends to be above 140 beats per minute, although this is more of a traditional belief than a proven medical fact. When carrying a girl, higher estrogen levels are often believed to cause stronger mood swings, increased irritability, and greater emotional sensitivity throughout pregnancy. Here are some symptoms that are often believed to indicate a boy. When carrying a boy, morning sickness is often milder or less intense compared to girl pregnancies. When carrying a boy, many women are said to have a clearer complexion with more glowing skin. Hair may grow faster, appear thicker, and feel shinier. When carrying a boy, women often develop a preference for salty, sour, or protein-rich foods such as meat, cheese, and spicy dishes. Some also report having a bigger appetite compared to pregnancies with girls. When carrying a boy, the belly is often said to sit lower and appear more pointed, with weight gain staying mostly concentrated in the belly area, rather than spreading to the hips or thighs. When carrying a boy, some women report having steadier moods and slightly higher energy levels, which is often believed to be due to less estrogen influence compared to girl pregnancies. Both amniocentesis and CVS can accurately determine if the baby is a boy or girl. CVS is done earlier, around 10 to 13 weeks, where a small piece of the placenta is taken through the belly. Amniocentesis is done later, around 15 to 20 weeks, where a thin needle collects a small amount of amniotic fluid for testing. Both tests use ultrasound for guidance, take only a few minutes, and can also reveal if the baby is a boy or a girl. Symptoms cannot reliably predict a baby's sex, so focus on a healthy pregnancy above all.